Hi, I'm Dr. Jennifer Taylor.
And I'm Dr. Christy Porterfield. We're team doctors at HealthWorks, a family wellness center in Plano, Texas.
Have you ever asked yourself, how do I keep my family well when I don't want drugs to be the first and only answer, or maybe even how to avoid medications altogether?
Absolutely, and we have many families that come in and they've tried a little bit of alternative healthcare here or there, some home remedies. That's the route they want to go, the natural route, but they don't have any systematic way of making that part of their healthcare.
Have you ever looked at your health with an actual strategy in mind? And what we mean by having a strategy is taking a step-by-step approach to make sure that you reach your health goals.
When we look at taking care of our health in a strategic manner, there are three main categories that we have to explore. Number one, physical health. Is our body in good shape? Are we getting the kind of movement that we need? Are we sitting too much? Chemical health. That is the foods that we eat or the things that we shouldn't be eating. Medications, air pollution, things like that. And then emotional health. Are we telling ourselves that we feel good, that we're happy, that we're successful? Emotional health is all about what our brain is telling our body about what's going on in our life. Are we so stressed out that our body thinks we're under attack and is not working properly?
Many people that come into our office have heard about the physical, the chemical, and the emotional. But have you heard about the system that controls it all, the true foundation of health?
So what is that missing link? It's your nerve system. Your nerve system is what controls everything that goes on in your body, from regeneration of tissues, digestion, healing, immune system. It's all controlled by your brain, sending information down to your body through the spinal cord and then out through all of the nerves. That's how your body knows how to be healthy. Looking more in depth at that missing link, there's a foundation to our nervous system as well, which is an area of the spine called Atlas C1. This area is primary to everything going on in your body and can create havoc from head to toe.
Dr. Christy actually has an excellent video that goes over C1 Atlas in greater detail on our YouTube channel, so check it out.
A practicing chiropractor for about 5 years when I had a patient come into the office that her stories just really stuck with me. She was a young mother. She'd been having recurring bladder infections time after time after time after time, and she'd done a lot of things, both medically, treatment-wise, and home remedies to try and take care of this problem. She'd been on many rounds of antibiotics. She tried changing her diet, adding cranberry, a lot of different things that we often hear can help with bladder infections. And she had some results, but limited, and the problem kept recurring. When she came into our office, what we checked her for is what we check every patient for initially, which is how well is her nerve system working? How well is her brain communicating with her bladder to make sure that that organ, along with all of her other organs, are functioning the way that they're designed to? And what we found with her was that she had a lot of stress in her low back, in the nerves that go to her bladder, as well as some other digestive organs. On our scale, they were high on the scale as far as stress, not working well. What we began to do in our office was take care of that stress, adjust this patient, and make sure that her body was beginning to work better. At the same time, she was also getting some testing done medically, and what they ended up finding, the reason that this has stuck with me so much, is that her bladder was not fully emptying because of the nerve system distress. And so she was ending up with a situation going on in her body where the organ wasn't working well, and then she had the symptoms again and again and again. And that's why all of these other things were so limited in how they could help her. And so eventually, this story has a great ending. Eventually, once we were able to work with her long enough to get those nerves back working the way that they were designed to, then her organ was able to work the way that it was designed to. And I'm happy to report that she's been bladder infection free for many years now.
So as you can see with just that one story, and what we hear multiple times with all of our patients, is that when the nervous system is functioning well, we have such a strong foundation which we can actually build health exponentially.
So now that we have a strong nerve system foundation of health, what we'll begin looking at is the physical, the chemical, and the emotional building blocks that go into a fully functioning, healthy parent and child. The physical aspect of health is key. Our bodies are designed to move and move in the right kind of way. And with our modern society, we do an awful lot of sitting. This hinders things like digestion and lymph flow, detoxifying of the body. There's been a recent study, Dr. James Levine of the Mayo Clinic at Arizona State University, he looked at all of the sitting that we're doing and he likened it to smoking. So here's what he said. Sitting is more dangerous than smoking. It kills more than HIV and is more treacherous than parachuting. We are sitting ourselves to death.
The next one includes our chemical health. This includes the junk food that we eat, or what I like to call non-food, as well as the substances that we use to do our hair, that we rub on our bodies. All those things make a huge difference in how chemicals and how our environment is affecting our body and our health. Did you know that Americans consume 4 pounds of pesticides every year and 193 pounds of genetically modified foods that we yet to discover what those actually do to our bodies? Even our water contains estrogens from birth control pills, as well as antidepressants like Zoloft and Prozac. You know, there's also chlorine and fluoride, which are also known neurotoxins.
These drugs found in our water supply, along with other ones that have been prescribed to us, all change the way that our body works. Now, sometimes that can be life-saving, but I think we can all agree that if we're taking a drug to change the way that our body works, we're not healthy.
Not at all.
Our emotional health is also critical. Most of us realize that if we're angry or we're stressed, then we're not functioning at our best. But I don't think that most people realize the depth that it affects the way that our body functions. When we are angry or scared, stressed, our nervous system goes down, our immune system goes down, our digestion and tissue repair, they all go down. We cannot be both in a state of stress and health and healing at the same time.
Stress can even change our gut flora. You know, those protective probiotics you've been hearing so much about? Just stress itself can actually change the makeup from the good guys to the bad guys in mere seconds.
Most families, when they come into our office, they have 5 basic questions. The first 3 are all about what's going on with me and my child. Can you help me? How long will it take before I start feeling better and before my body's working better? The other 2 questions are more pragmatic. They're about how much will it cost? How much will my insurance contribute? Can I afford this?
And we truly pride ourselves in answering all of those questions when you come into our office.
Question number 1, what's going on with me and my child? Our process is to get to the bottom of that. We want to know, why are you not functioning the way that your body is designed to function?
In the current system of traditional healthcare in America, the why is rarely answered. Often patients are given a diagnosis, they're given a drug, or possibly a surgery, and that's the end of it. But the question why is never answered. Why did my body do this? What is it that changed in my body? It's truly not a lack of aspirin. It's not a lack of some certain body organ that got you this way. We want to answer that question, why?
Your body is designed to be self-regulating and self-healing, and if it's not, Let's find out why. So here's how we find your why. First, we start with looking at the nervous system. Remember, that's the foundation. Is your brain communicating with your body? Is your body working the way that your brain's trying to tell it to? Everybody's why is different, and that's why we take a step-by-step approach to make sure we figure out what your why is. We always start with the nerve system because that's the foundation.
You know, the way we find out everybody's why is by really looking at that foundation. And with one of our younger patients, 6-year-old boy, he actually came in with his parents. He had chronic asthma, bronchitis, immunity issues, allergies. He didn't come in for back pain. He came in because his parents realized that his immunity will actually come from his nervous system if that's functioning properly. So as part of that process, we actually took scans of the nervous system. Did you know that you only feel 10% of what's going on in your nervous system? What we do is we actually can look under that surface and look at the 90% that you can't feel. So in just a moment, you'll actually see pictures of what that actually looks like, the before, the afters. We look at his posture and the dramatic changes that it made before and after. We did adjustments primarily. That is working on that foundation. Then when we got that stabilized, we were able to look at nutrition. He changed his nutrition dramatically. This helped him to completely get off his medications. Wouldn't every parent want that?
These scans are the actual nerve system investigation of the young boy that we were just talking about. His scans in the beginning showed tons of nerve system interference. See how all the colors are just red and blue and green? These are all areas that are showing a nerve that is not working well. The white is an area that is working well. Now take a look at his afters. This is after this young boy had been adjusted for a few weeks, and notice the dramatic decrease in interference in his nerve system. This is the point where the parents began to see some real changes in their child's health.
The next question that most patients have when they walk in is, can you help me? You know, we guarantee that we'll only accept your case if we can truly help you. And in the rare instance that we can't, we have a network of doctors that we can refer you directly to.
In our office, we take this systematic step-by-step process, starting with the nervous system, looking specifically at the foundation of the nervous system, Atlas C1, which is a specialty in the chiropractic field. Another question we often get is, how do I know if I've had upper cervical C1 Atlas care? Well, there's a few things. Since it is a specialty in the chiropractic field, normally your chiropractor will tell you all about Atlas C1 and let you know that you are receiving specialty work. Some of the hallmarks are that you will have precision posture and leg length checks. You will have before and after upper cervical films taken, and your chiropractor will discuss with you what the changes there are, how you've healed in this area. Many times when our patients refer other families to our office, they'll get a response something like, well, I've seen a chiropractor before, or, oh yeah, I've had chiropractic care in the past. One of the strengths and one of the weaknesses all combined together about the chiropractic profession is that every chiropractor does things a little bit differently.
It's an art.
It's an art. Mm-hmm. It absolutely is an art. And the reason that patients get results in our office where maybe they haven't gotten results before is because we take that systematic approach to health.
The next question is, how long will it take? That's usually a two-part question. Either how long will it take for me to get better and how long will it take for actual correction? Both have very different answers. The other part of that question is, how long will I need to be coming into your office? Well, when we talk about building health versus stopping a symptom, these are very drastically different things. What is it that you're looking for? A roller coaster ride of symptoms up and down to deal with one problem after another, or you're looking to build health over a lifetime? We believe that everybody's looking for lifetime care somewhere, and we aim to help you build your health over a lifetime.
As doctors in the healthcare profession, we feel like there is way too much unpredictability on what our healthcare costs are going to be. We don't like that for our family, and we don't want to pass that on to your family either. That's why we developed something called a concierge model of chiropractic. In this model, you will know exactly what your costs are going to be before you ever come into the office. Additionally, you will receive everything that you need for your healthcare in our office at one low, predictable monthly rate.
And the last question we get is, what will my insurance cover? A large part of the reason why we decided to go to the concierge chiropractic model is because insurance is highly unpredictable on what they will and will not cover. So typical in-network deductibles are $2,300 per year, and out-of-network is $5,000. Those are 2012 estimates, by the way, so we know they haven't gotten any better. Because we keep our prices real, we keep our prices low, the entire year of care wouldn't even reach deductible.
Health insurance is a lot like auto insurance. Just like your auto insurance isn't going to pay for things that will help your car to last longer over the years, like new tires, oil changes, tune-ups, your health insurance is not going to pay for those things for your body either. Health insurance, like auto insurance, is for when your body crashes. The approach that we take in our office is about wellness and taking care of your body, extending that lifetime warranty so that you don't end up in a crash in the first place.
We speak with so many families who are doing so many things to keep themselves healthy, and yet they're still struggling. If this is you or your family, let us help you put together that strategy towards optimal health.
Our goal as practitioners is to raise the health of our community. We want to help you answer your family's why so that you can have health building for a lifetime.
So what is the next step? Call our team now. They're ready and they're waiting to make sure that we find the perfect time for you and your family to make an appointment.
In fact, if you let them know that you watched this video, we'd like to offer you a special $100 discount off of your first appointment. Call us now.